Welcome to the deep dive. Today we're cutting through the noise on a topic that, well, affects pretty much all of us, health in the workplace.
hmm
We've gone through a really big review, 88 studies from 2011 right up to 2024, to figure out what actually works when it comes to employee well-being.
That's right. And workplaces, they're a really strategic place for this kind of thing.
How so?
Well, they've got the infrastructure, right? And daily access to loads of people, including, importantly, groups that other health initiatives might miss.
Okay.
So we'll be looking at what employers, employees, and even society are doing together to boost health at work. Things like stress, mental health, physical well-being, the whole picture.
Right, let's unpack that. The review flags some major concerns tied to work. Like nearly 40% of workers are seated most of the day,
Yeah, it's a huge number.
and up to 60% of what we eat each day. Apparently that happens during work hours. So what interventions are actually targeting these kinds of issues?
It's quite a range, actually.
Huh.
Mental health and stress reduction, they were the most common targets by far.
Really?
Yeah, about 36% of the interventions studied.
Yeah.
Then you had weight management and cardiometabolic health, think heart disease risk, diabetes risk.
Got it.
That was another 25%. And the types of interventions are all over the map. Individual wellness programs, sure, but also environmental changes like nudging people towards healthier food choices in the cafeteria.
Okay, so a lot is being tried. But what does the evidence say actually shows promise? What should you, listening now, take away from this?
Well, based on what we'd call moderate quality evidence, and we'll come back to that quality point,
Okay.
mindfulness interventions seem pretty effective. They showed positive results across different stress and mental health measures, reducing burnout, depression, anxiety.
Mindfulness, interesting. Anything else?
Yes.
Huh?
Cognitive behavioral techniques, CBT,
Mhm.
helping people reframe negative thoughts. And also some physical stress reduction methods showed, well, some effectiveness.
And what about the physical side? That sitting problem you mentioned.
Right. So for sedentary behavior, environmental tweaks look promising. Things like sit-stand desks.
Ah, yes, those. Do they work?
Apparently, they can cut sitting time by, get this, 64 minutes a day on average.
Wow, over an hour.
Exactly. And some multi-component programs, ones doing several things at once, showed small effects on weight loss and getting people to eat more fruit. But, and this is a big but,
Oh,
the effects on individuals were generally pretty modest. It's not like these things are magic cures, more like gentle pushes.
okay, modest effects. But let's talk about the evidence itself, because you mentioned moderate quality, and the review found something really striking here. Only 21% of all the findings had moderate quality evidence, and none were high quality.
None. Zero.
What does that tell us? Is a lot of this built on, well, shaky ground?
That's exactly the concern. I mean, it shows that despite tons of research happening,
Right.
we often lack really solid proof for many common workplace programs. A lot of the studies had issues, like a moderate or even high risk of bias.
Bias in what way?
How participants were selected, how results were measured, things like that. Plus, you see huge variation, heterogeneity in the findings. Different studies get wildly different results.
So it's hard to say this definitely works.
Precisely. It tells us we really need better quality, longer-term studies to be sure about what's effective.
That evidence quality issue is a major point. But the review also looked at who these programs are reaching, or maybe who they aren't reaching. Did it touch on socioeconomic inequalities?
Yes, and it's a critical point. The research tends to focus more on workers in higher socioeconomic positions.
Like office workers?
Exactly. Office workers are studied far more often than, say, manual laborers, especially for physical activity interventions. And there's a big gap in research from low and middle income countries, too.
So we might be designing programs based on data from a specific group and potentially missing what works for others. Or even widening health gaps.
That's a real risk, yes. While some analyses suggest the effects might not differ hugely between groups, the sheer lack of representation is a problem. We need to be much more inclusive in who we study.
Makes sense. And one last thing, the review mentioned a kind of philosophical debate. Nudging versus boosting. What's
Yeah.
the difference there?
It's about how you try to influence behavior. Nudging uses environmental cues to sort of steer you gently, like putting healthy snacks at eye level.
Okay, subtle changes.
Right. Boosting, on the other hand, is about equipping people with the actual skills and knowledge to make better decisions for themselves more independently.
And which is better?
Well, the review suggests nudging shows some promise, but we need a lot more research on boosting's effectiveness in this context. It really highlights that there's probably no single best approach for everyone or every situation.
So wrapping this deep dive up, it seems workplace health is vital, absolutely, but the science behind it is still, well, developing.
Definitely. We see some bright spots. Mindfulness seems promising. Environmental changes like sit-stand desks can help.
Yeah.
But the generally modest effects and these big questions about evidence quality and reaching everyone fairly, it means we're really just starting to figure out how to truly optimize health through our jobs.
So for you listening, what's the takeaway? Maybe think beyond just the official wellness programs your workplace might offer. Consider how the actual design of your work, your office, your schedule might be shaping your health in subtle ways. And perhaps think about what role you could play in advocating for programs that are not just offered, but are robust, evidence-based, and truly designed for all employees.